Prostate cancer is one of the most common forms of cancer in men around the world. It starts in the prostate, a walnut-sized gland found right below the bladder.
The prostate is a gland in the male's body. It forms part of the male reproductive system and is actually the part that helps to support during erection and so during sexual intercourse, and to help with the production of the energy for the sperm, etc., etc. Part of the urethra, which is part of the urinary system, passes through the prostate. That's why you can ejaculate as well as urinate through your penis. Cancer is basically an abnormal proliferation of cells. So it's an abnormal proliferation of cells within the prostate gland. Of course, it can spread beyond the prostate gland, but it starts within the prostate gland.
There are risk factors associated with prostate cancer. The disease is most common in older men above the age of 50. Hereditary, or a family history of prostate cancer. Men of Black African ethnicity seem to be at a higher risk.
Being a man predisposes you, without any apologies, plain and simple, to prostatic cancer. An elderly gentleman is more prone to developing prostatic cancer versus a younger gentleman, usually people 65 and above. However, it is not limited to that age group. You can see people as young as 35 years, developing prostatic cancer, and in most of these cases it is because it was inherited, meaning that they would have gotten a gene which probably would have been passed down from generation to generation that would make them develop the cancer at a much earlier age. So it would help the cell to divide much more rapid, and then they develop the cancer. So that also is a risk factor. Inheritance, your genetic disposition also is a factor, and you have other things like lifestyle habits, smoking, alcohol intake, eating foods high in fats, eating foods high in sugars and calories. That also predisposes one to developing cancer of the prostate.
Prostate cancer is typically a very slow growing tumor, often causing no symptoms until advanced stages. Symptoms may appear if the tumor makes the prostate larger than normal and it starts to press on the urethra.
Most of the symptoms that you get to start off with are symptoms with the urine. So you find that you want to urinate, but you cannot begin to urinate. When you do finally urinate, you get the sensation that your bladder still has urine in there and you still want to pass more. A lot of men complain of getting up frequently at nights, sometimes 5-6 times for the night to pass urine, and their water intake has not increased significantly to match how frequently they're going at nights. You also find sometimes if the ejaculation could be bloody, or they can have a bloody discharge coming from the penis as well. And you can also find when you begin to urinate that there's a break in the urine stream and then it starts again. Sometimes you can find that the urine stream comes in two, so it's doubled. Again, you can find that if you're used to urinate a far distance, sometimes you find that it falls directly at your feet, so it doesn't have the extra push as it used to. And all of these actually are linked to the fact that the prostate gland is swollen, so it's compressing. So most of the symptoms are actually urinary symptoms. Sometimes you can find people presenting with back pains, lower back pains. That can also be a sign, and that could be due to the fact that the prostate gland is getting heavy, and so it's putting pressure on the back there, as well as it could mean that the disease has advanced out of the prostate and has gone into the bones, which is actually the number one site where prostate cancer goes.
One of my friends said, sometimes you get a negative, but it's a false negative. And so you need, once the PSA is high, and they didn't associate it with an enlarged prostate, you need to continue checking. And I continued to check. And at this time came where it was positive. And I just decided, I said, if this time it showed negative, I'm not going to bother about it anymore. And it turned out to be positive that time.
The key to the effective management of prostate cancer includes early detection, using regular physical exams, and a simple blood test called PSA test.
There is a examination which most men are afraid of. It's called a direct rectal examination, where they use the index finger, insert into the rectum and have a feel around. The prostate is right there, so they're able to feel, they can tell if it's enlarged, they can tell if the surface is rough, and if they can feel any lumps, if the prostate is painful, and all of that. And then they would combine that together. They'll do an ultrasound of the pelvic, which would give an idea as to the size of the prostate, and would also pick up if there is anything within the prostate as well. And they can also do CT scan, which can give an idea as to actually if it is cancer, if it has spread, gone to other organs, gone to the bones, and all of that. Then they'll do a blood test called a PSA, prostatic specific antigen, which is antigen. The prostate actually produces that, and it's specific to the prostate, and it reads within a certain range. If it's elevated, then according to the range it's in, it gives an idea as to what is wrong with the prostate. And last but not least, they will do a biopsy, which is a tissue sample of the prostate. It's a little bit of a specialized test, so you have to get a surgeon again to do that. Go up in through the penis and take a sample of the prostate, send it to the lab for testing to confirm the suspicion.
Over the years, I've been doing PSAs. The time came when the PSA went up significantly high. The doctor started to treat me possibly for enlarged prostate. But when that didn't work, he decided to do a biopsy. The first biopsy was negative. The second biopsy was also negative. But the third one showed that there was cancer. And the doctor gave me several options on which to act. I chose one. And it's successful. I mean, it's 6 years now, and I haven't had any problem at all since that time.
Men can start having regular physical exams and PSA tests in their mid-40s. If there is a family history of prostate cancer, men should start having regular tests earlier. Early diagnosis will allow early access to treatment if necessary. If prostate cancer is diagnosed and treated early, the risk of dying from this illness is small. If prostate cancer is diagnosed late, when it has spread to other parts of the body, then it cannot be cured.
After I did my procedure, let's call it that, the day after, a friend of mine would say, "Boy, I'm glad that you did this thing, He said, "I need to go and do my test regularly too." He said, "Because I saw my father suffer from prostate cancer and I don't want it to happen to me." And I thought that was a very good, it's true, I got it after I did it, but I think it's very good for men to know that if you allow it to reach the stage where you can't control it, you suffer quite a lot before you die.
The treatment options for prostate cancer depend in part on age, overall health, and whether the tumor has spread. The oncology clinic at the General Hospital offers treatment to men who have been diagnosed with prostate cancer. Treatment often begins a few weeks to months after diagnosis.
There are 3 options given to me. Well, I should say four options. One is watchful waiting. That means to say, in some cases, some people live their whole life and nothing happens. The other one is to do what is called, I'll tell you the 3 options that I'll give, other than watchful waiting, to do a radical, which means remove the prostate completely. The other one is to do brachytherapy, where they put seeds around, radioactive seeds, around the prostate, and that burns off the prostate. And the third one is radiology.
Common in Grenada, we give the tablets, the anti-testosterone tablets, and remove the testicles as well. But mostly we tend to give the tablets.
Men who consume large amounts of fat, particularly from red meat and other sources of animal fat, are most likely to develop advanced prostate cancer. The underlying factor linking diet and prostate cancer is thought to be probably hormonal. Fats stimulate increased production of testosterone and other hormones, and testosterone acts to speed the growth of prostate cancer. High testosterone levels may stimulate dormant prostate cancer cells into activity. Some findings suggest that high testosterone levels also influence the initial onset of prostate cancer.
The doctor gave me a list of things what I should take, that there should be regular exercise, and I try to do as much of it as possible.
A healthy diet and regular exercise and examinations by a medical doctor can go a long way in maintaining good health.
What we would advise, or what we would like to stress, is that you should try to take your health quite seriously. Don't be afraid to go to the doctor, even if you're having some sort of symptom. Don't become embarrassed because it's involving the reproductive system, even if you have some erectile dysfunction as well. Go to the doctor, have discussions. The rectal examination, yes, it is uncomfortable, yes, it puts you in a compromising position, but at the same time it's important to do. And if you have a strong family history of prostate cancer, particularly if your father would have had it, or you have a brother who would have had it, you should try and get tested at least annually. Try and do your PSAs annually, and keep a check on it to make, if it's showing any signs of increasing, have that checked out, and advise your friends also to do likewise.
It is important for men to check regularly. It is very important. If you don't want to fall into the category where that friend of mine said happened to his father, if you don't want to fall, it is important to check. And checking, except for the little bit of blood they take to test for the PSA, it's not anything difficult. It's not painful or anything like that. You do it, and it helps you eventually. If you're diagnosed with prostate cancer, it helps you to get early treatment. And that is what is important, early treatment. The later you remain, the worse it becomes.
If you have questions about prostate cancer and what you can do about it, talk to your healthcare provider at your community health center or medical station.